Here's the key clinical riddle. SLE, prior sudden vision loss, and now a long spinal cord lesion from C4 to T1. The correct association is not a typical lupus flare, it's NMOSD, lock this in. Blindness plus a long cord lesion is a pattern, follow the pattern to the right test. The NMOSD triad. 1. Optic neuritis leading to sudden vision loss. 2. Recurrent transverse myelitis causing weakness, hyperreflexia, and urinary retention. 3. LETM, longitudinally extensive transverse myelitis, spanning 3 or more vertebral segments. C4 to T1, that is very long, classic LETM. NMOSD loves 2 targets, the optic nerve and the spinal cord. When the cord lesion is long, spanning multiple segments, think LETM, think NMOSD. Triad, recap, optic neuritis, recurrent myelitis, and LETM. If you see 2 or more in one patient, especially with a long cord lesion, your differential should spotlight NMOSD. Key test, AQP4 IgG, also called anti-NMO. It targets aquaporin 4 water channels on astrocytes, the brain's water gatekeepers. Binding triggers inflammation and complement injury, damaging astrocytes and disrupting the blood-brain barrier. Result, optic neuritis, painful vision loss. And in the cord, a longitudinally extensive lesion, LETM. Relapses are common, the disease is often relapsing if untreated. Order a serum AQP4 IgG cell-based assay, the high-yield confirmatory test. See the pattern? Run the test. Guide therapy. NMOSD versus MS, quick and high yield. Think stripes for NMOSD and spots for MS. NMOSD often has severe optic neuritis, MS is usually milder. AQP4 IgG defines NMOSD, not MS. CSF oligoclonal bands are often negative in NMOSD, often positive in MS. So, LETM, severe optic neuritis, and AQP4 IgG point to NMOSD. SLE doesn't exclude NMOSD. Autoimmune overlaps happen. Anti-SSA is a clue to autoimmunity, but the neurologic fingerprint is optic neuritis plus LETM. Don't get trapped thinking every neuro event is just lupus. Pattern beats assumptions. Mnemonic, NMO equals nerve plus marrow overload. Nerve is optic neuritis, marrow is spinal cord. Overload means a long lesion. Blindness plus a long C4 T1 lesion. Test AQP4 IgG. Think NMOSD.